Hello everyone. As we have discussed in our last session, what is IVF, how it is performed. So there is one more technique in IVF and it is known as ICSI. ICSI is one of the biggest advancements in IVF since past 20 years. There are certain conditions where ICSI is mandatory. So should you be opting for ICSI or not? Let's discuss it today. What is ICSI? What are the conditions where ICSI is required and how it is ICSI performed? So if you have any queries regarding this, do write them in comment section and I'll reply to all your queries. I am Dr. Aashita Jain, fertility expert, Bavishi Fertility Institute. The basic idea behind IVF is the egg is taken out of the ovaries and it is fertilized with the sperm outside the body in the laboratory. Now, there are two techniques of fertilization. First is standard insemination. In this technique, we put thousands of sperms in a petri dish near the egg, and in this, the sperm has to penetrate the egg on their own. Like you can see here, which we have discussed earlier also, this is a petri dish where the sperms and the eggs are kept, and the sperm have to penetrate the egg on their own. This is a conventional IVF. This has been largely replaced by ICSI. ICSI is Intra Cytoplasmic Sperm injection. This is an ICSI machine where an ICSI procedure is performed. In ICSI procedure, a sperm is injected inside the egg with the help of a glass needle, which is known as a micropipette. Like you can see here, this is a mature egg and this is a micropipette where the sperm is loaded. With the help of this micropipette, the sperm is being injected into the egg. This is how an ICSI is performed. ICSI is very similar to IVF. The only difference is the technique of fertilization. In one, the sperm has to penetrate on their own, whereas in the other, the sperm is being injected into the egg with the help of a micropipette. So there are several conditions where ICSI is required. Let's discuss what are these conditions. First of all, the men in whom the sperm count is very low or the motility is very low, standard insemination might fail. Sometimes even in the standard insemination, if the sperm number is normal, fertilization might fail. And this might be due to a specific problem in the sperm of not fertilizing an egg, which we cannot predict ahead of time that which men might be having the sperm which will unable to fertilize the egg. So these problems are bypassed in ICSI. And the fertilization failure in ICSI cycles are very low. In the egg, which is retrieved from the ovaries, there are cells which surrounds the egg and this is known the cumulus cells. Cumulus makes it difficult to see an egg under the microscope and hence it is difficult to recognize which are mature or immature eggs. Immature eggs does not fertilize by the sperm. So there might be chances that in cases of fertilization failure that immature egg number is more rather than the sperms. So in ICSI, we get this cumulus stripped off so that the egg is visible more easily and with certainty we can make sure whether it is a mature or an immature egg and we can improve the results. The other condition is men with poor morphology where the number of abnormal sperms are more. ICSI is helpful. In cases of men with retrograde ejaculation, in this Men are unable to ejaculate via urethra and the sperms are being collected into the urinary bladder. So in these cases, sperms are retrieved with the help of a technique known as TESA or MESA, in which the sperms are retrieved from the testes or epididymis, and these sperms can be used for ICSI. In men with azoospermia also, ICSI is helpful. Men with erection difficulty or ejaculatory difficulties due to any of the health issues, ICSI might be beneficial. The cases in which previous IVF history of no or low fertilization rate, ICSI is helpful. In women in which we get very less number of eggs after ovum retrieval, ICSI will be helpful. And finally, in condition where the genetic test has to be performed, ICSI is mandatory. Because with standard insemination, there might be chances that sperm may not fertilize the egg but get stuck to the egg, and this will give the false result. So ICSI is necessary in case of genetic testing. So broadly, ICSI is necessary for male factor infertility and will help in improving the rate of conception. In ICSI, a single sperm is injected into an egg, and the utmost importance is given to select a high quality sperm which will fertilize the egg, and the chances of fertilization are good. So now let's see how the sperms are retrieved for ICSI. In cases of men with low sperm count or low motility, sperms are retrieved with the help of normal ejaculation. In cases of men who have undergone vasectomy, microsurgical vasectomy reversal might be helpful, or if it fails, then the procedures like TESA or MESA may be used to retrieve the sperms from the testes or epididymis with the help of the needle aspiration. In this, a very fine needle is used to aspirate the sperms, and a required number of sperms are aspirated, and ICSI is performed with the help of these sperms. So these are the techniques by which we can retrieve the sperms, and then the ICSI is performed. So let's see how an ICSI is performed, or what is the procedure of ICSI. As ICSI is similar to the IVF procedures, so are the steps. So the steps are: first is the ovarian stimulation, in which the ovaries are stimulated with help of the medication in the form of injections to produce large number of follicles, and this is monitored with the help of sonography and the hormone levels. Then comes the egg retrieval. Once the follicles has reached to a required size, the eggs are retrieved from the ovaries, generally 34 to 36 hours after the trigger injection. Then is sperm selection. A high quality sperm with good motility is selected for ICSI. Then comes the egg assessment. After retrieving the egg from the ovaries, the cumulus is stripped off so that egg is prepared for the insemination. Insemination is the most important part of the ICSI, in which a sperm is injected into the egg with the help of a micropipette, as I have shown earlier. Then comes verification. The next day it is seen whether the eggs are fertilized by the sperm or not. After fertilization comes the embryo transfer. The embryos formed are then being transferred into the female's uterus, and generally we transfer 2 or 3 embryos. After the embryo transfer, a blood test is performed generally after 2 weeks, in which we check the beta-HCG hormone, which will let us know whether the treatment done is successful or not. Now let's see what is the success rate of ICSI. ICSI is very successful than IVF. In ICSI, advanced technique is used with the help of which high quality sperm is being injected into the egg for fertilization. In ICSI, generally 50 to 80% of eggs are fertilized, hence failure rate is very low in ICSI. It is one of the most effective and successful fertility treatment, and it is gaining its momentum because of its high success rate around the globe. ICSI is now being performed on more than half of the IVF procedures done worldwide. So, if you have any queries regarding ICSI, do write them in comment section and I'll reply to all of them. Thank you.